Hello my doctor supporter, welcome to medical science class. As a student of medical science, I wanted to take further advance of science activities. So that is not, that is not, that is yes, and that is clear, that is not. As a mystery, always the one and only creator, except the all application, past English, percentage, and all. Now my friend is about medical science class. Medical science class, I learned medical science. I student of medical science. Why I say student? Because medical science is vast. Not only medical science, any branch of science is vast. That is very. Dr. Sir, I say student of medical science. As a student of medical science, I wanted to take play by every branch of medical science. And how much patient? Medical science class. Medical science class, learn medical science. Learn medical science. Now my contents of that. Medical science class. We describe it also MS musculoskeletal pain. In case of musculoskeletal pain, how you understand that muscle pain or bone pain? In case of muscle pain, if you press your body, you feel the pain. Now I press my body, I not feel pain, but I feel the pain in pain. When I movement the joint, the pain go to the joint. Now you understand that when press the muscle, pain. Now I feel the pain of muscle, and I also joint. So both muscle and bone pain. In case of muscle, there is a tendon Achilles. In that place, pain. Okay. Both muscle pain and bone pain. Also, when I move the joint, feel pain. That is the sign of musculoskeletal pain. I feel both muscle pain and now diagnosis bone pain. What is the reason? I do exercise and playing football in there. Also do gym. But in that situation, no trauma occur. No trauma occur, but muscle injury. What is the treatment of musculoskeletal MS? Mild to moderate severe. In case of mild, acetaminophen, paracetamol, acetaminophen, 500 mg 3 times, 4 times, 6 times, 8 times. Acetaminophen is said. In case of moderate pain, you can control by paracetamol IV, acetaminophen IV. But if you not to go to the IV route, then go to the NSAID with omeprazole. And NSAID, if you take NSAID, there is a chance of NSAID induce 50%. NSAID and omeprazole. What is that mechanism? You say, everybody say, if you take that, why cure that? NSAID anti-inflammatory effect. NSAID has anti-inflammatory effect, antipyretic, anti-analgesic combination. Acetaminophen weak NSAID. In case of acetaminophen, no need omeprazole, but NSAID strong painkiller. Usually say, if you take that with omeprazole, without omeprazole, and 7 days, there is a NSAID induced 50%. That is the reason NSAID, non-steroid anti-inflammatory drug, take with omeprazole. Common silly mistake. Maximum when pain come, you take NSAID. In case of Europe, you take NSAID and NSAID induce 50% disease. That is the reason if pain occur, you take NSAID with omeprazole. If you take NSAID with omeprazole, if feel pain, NSAID with omeprazole. But which pain, what is the reason? What is the organ affected? Muscle, bone, joint, that quality. That is the reason with doctor permission. Now MS, I not give any, somebody give calcium, vitamin D. Calcium, vitamin D, what is the value of calcium, vitamin D? If you have muscle and bone pain, your age is not equal above 60 years. What is the value of calcium and vitamin D? I don't know. Still now I search. Your bone remain good. When your age above 60 years, then when calcium necessary, calcium index reduced, then you need calcium. Although there is a calcium is food, then vitamin D in morning hour sunlight, vitamin D3 easily available. That is the suggestion. But why give the calcium? I don't know. Before your age is when your age equal above 60 years, bone disease occur, osteoporosis or other bone disease occur then. But why do you give calcium available? I don't know. Still now I not find that. My friend my patient, you should have tried to doctor ask them. Which drug, what is the reason given? Which drug, what is the reason given? That is patient right. Case of my patient also, you should have tried to ask which drug, what is the reason given? Please explain. What is my diagnosis? What you diagnose me? Then I say maybe diagnose that disease. That is the reason I give that. You as a patient, you should have right and choice to know that. If you do that, you will less chance of misinterpretation, less chance of misdiagnosis. If misdiagnosis occur, for my patient, what I give the drug, first drug taken, what is the reason you come and what is the symptom you come. If not reduced, that come in follow up. That is misdiagnosis, chance of misdiagnosis. Otherwise, the drug is not coffee drug, or the drug is raw material is not remain good. That is the reason first dose taken. Or I say my patient, after taking the first dose or first medication, what is the reason you go to the hospital, go to the doctor, it not subside, it not reduce, you know that treatment protocol is not good. And say to doctor, what is going on? Treatment protocol. Still now I take the first dose, why not reduce the symptom? You should have tried to ask the doctor, please check up doctor, please doctor check up, is there misdiagnosis or not, or anything need or not, just like that. And in case of musculoskeletal pain, NSAID with omeprazole, treatment of choice. But there is not traumatic injury occur, there is not anything occur, then if fracture occur, then calcium needs. If fracture, trauma, bone fracture, then either was why calcium, why vitamin D, I don't know. You remain good, bone fracture is not occur, limb remain good, you can walk, but you feel pain. That is called MS, musculoskeletal pain, NSAID and omeprazole is enough. In case of NSAID, non-steroid anti-inflammatory drug, full with stoma, and omeprazole half hour before meal, you take that. and after taking that you do your normal activity. There is a which joint more affected, you do to go to the exercise. And what is the exercise, you know that. For example, my hand that restricted the joint movement. If take that medication, the pain is not cured. What is the reason? There is a maybe traumatic injury. Still now I have no traumatic injury. So I know that there is no chance of traumatic injury, no chance of infection, swelling, sign of inflammatory, rubor, color, dull or tumor, not sign of inflammatory, not. Now what is the reason? Injurious material. What is the reason I feel the pain? There is a maybe infection is not occur, but feel the pain. And when you take the MS musculoskeletal pain reduce after first dose, you continue that and do the exercise. What is the exercise? That your joint is not swelling, there is not sign of inflammation. Then joint movement. In case of wrist joint, wrist movement. In case of elbow joint, elbow movement, and free them. After taking medication, if there is fracture remain, pain not reduced, go to the hospital and take a X-ray, musculoskeletal system, take a X-ray. Is there is any fracture or anything occur or not? Then if fracture, then management of the fracture. Thank you very much, my friend supporter. Today is enough from medical science class. No.